Good afternoon, and thank you very much once again for joining us. I'll start with the usual update on today's statistics. The total number of positive cases reported yesterday was 2,160. That represents 7.5% of the total number of tests and takes the total number of confirmed cases in Scotland to 159,239. 636 of today's cases were in Greater Glasgow and Clyde, 339 in Lanarkshire and 262 in Lothian. The remaining cases are spread across 11 other health board areas. As of yesterday, I can also confirm that 224,840 people have received their first dose of vaccine. In addition, 1,860 people are currently in hospital. That's 31 more than yesterday. 141 are in intensive care, which is a decrease of 1 from yesterday. And sadly, 61 additional deaths have been registered in the last 24 hours of a patient who first tested positive over the previous 28 days. That means that the total number of deaths under this measurement is now 5,227. That total reminds all of us of the heartbreak that this virus continues to cause. And once again, I want to offer my sincerest condolences to all those who have lost a loved one during this pandemic. I'm joined today by the National Clinical Director, Professor Jason Leitch. In a few moments, Jason will say a few words about cancer services. He will also say something about the importance of protecting mental health and well-being at work. But before that, there are two key issues that I want to provide an update on. The first concerns international travel. As you know, it is currently illegal for anyone to travel to or from Scotland unless it is for an essential reason. Even with such a reason, anyone travelling from overseas may still be subject to the quarantine requirements. Last night, the Scottish Government, the UK Government and the other devolved administrations announced a further set of travel restrictions. They are a direct response to the new variant of the virus which has been detected in Brazil. So from today, there is a ban on visitors coming to the UK from any part of South America. The ban will also apply to 3 other countries which have strong links to Brazil. These countries in terms of travel are Portugal, including the Azores and Madeira, Panama and Cape Verde. It's important to note that the travel ban does not apply to UK or Irish nationals or anyone else with a right of residence in the UK, such as EU citizens with settled status. However, even if you can enter Scotland, you are now subject to quarantine requirements in relation to these places. So anyone travelling back from any of these locations will have to self-isolate for 10 days upon their return. That requirement applies to everyone in their household as well, without exception. The new restrictions came into effect at 4 o'clock this morning, and they will remain in place as we await further evidence of the impact of the new variant. The Scottish Government also announced last night that a number of other countries and territories have been removed from the quarantine exemption list. The full details of these and of the other new restrictions can be found on the Scottish Government's website. However, our basic message on travel right now is a really simple one. Don't, if you can possibly avoid it. That's why it's illegal to travel to or from Scotland right now, unless it is for an essential purpose. My second update is about the further expansion of testing in Scotland. I can confirm today that asymptomatic testing of care-at-home workers will begin from Monday, the 18th of January, this coming Monday. We'd previously said that this rollout would be completed by the end of March. But given the seriousness of the situation that we now face, the timetable is being brought forward by 2 months. As a result, Scotland's 85,000 care-at-home staff will have access to testing by the end of this month. And I'd like to thank all of the different partners who've helped to make this possible. Care at home is a varied sector covering daycare services, sheltered housing, mobile care at home teams and personal assistance. So putting in place a system of testing for all staff has been complex. We continue to work with our partners across the sector to ensure that the rollout is as smooth as possible, and guidance on the new testing arrangements will be published shortly on the Scottish Government's website. I can also announce today that the fleet of mobile testing units operated by the Scottish Ambulance Service will be significantly expanded from 18 units now to 42 by March. We're also funding additional staff and equipment, which will allow each facility to be split into 2 smaller units. As a result, these units will then be able to reach up to 84 communities at any one time. These mobile testing units play an important part in making testing more accessible, and they are, of course, especially useful in rural and remote areas, particularly during the winter months. And we're expanding community testing in order to reduce community transmission by identifying and isolating cases that could otherwise be missed, doing that through our strategic targeting of testing in the community and other resources. We're investing 1.1 million with SEPA and Scottish Water to expand their wastewater surveillance capacity, taking that from 60 samples a week to 220 samples a week by the end of January. COVID-19 wastewater testing provides an additional source of data that can support the identification of communities with significant levels of transmission. Combining that expansion of community testing with the additional support for wastewater surveillance, along with packages of support to help people who test positive and require to self-isolate, is one of the additional ways that we're expanding our testing programme to track down, isolate and deal with positive cases. We've got 13 proposals across 20 council areas at the moment for the expanded community testing programme, and we will begin in Grampian and Fife, with the other areas coming on board shortly thereafter, and with additional Scottish Government targeted work on top of that. Together, the 3 announcements I've made today represent a significant expansion of our testing programme. They will help us to identify more cases of the virus, and as a result, they'll give us a better chance of stopping COVID from spreading. That race between this virus spreading and our vaccination programme, this community and other expanded testing will help us to slow down the spread of this virus as we scale up our vaccination programme. As I've said before, testing on its own doesn't of itself reduce transmission. It tells us if we're positive at any one point in time that we're being tested. It does not mean that we can stop following all of the safety measures which are in place. Which brings me to the point where I'll finish today before I turn to Jason. All of us, every single one of us, have an important part to play in suppressing this virus. The best way we can do that is to stick to the current restrictions, the rules and the guidelines. So let me take this opportunity to remind everyone, all of us, once again, of what they are. At the moment, our main message is very simple. Please stay at home. In any level 4 area, which is almost all of Scotland, including all of the mainland, you can only leave the home for essential purposes, such as caring responsibilities, essential shopping, or exercise. If you meet up with someone outdoors, you can only meet up with one other person from one other household. And you must work from home if you possibly can. And on any occasion when you do leave home, please remember facts. Wear face coverings when you're doing essential shopping, avoid anywhere that's busy, clean hands and surfaces, use 2-metre distancing if you're talking to someone from another household, and self-isolate and book a test if you have symptoms. As I've said, support is available if you need to self-isolate. Fundamentally, though, all of that means this is the best way we have of keeping ourselves safe if we stay at home as much as possible. That's how we can protect ourselves, our loved ones and our communities. And it's how we keep COVID under control while the vaccination programme continues. So please, stay at home, protect the NHS and save lives. And thank you once again to everyone who is doing just that. Jason.
Thank you, Cabinet Secretary. I want to cover briefly two subjects today. The first is ongoing cancer services in Scotland. They remain a top priority across the whole of the National Health Service and our social care system, including our partners in hospice and the third sector. The majority of treatments have continued throughout this pandemic, so please continue to attend as normal. Do not be scared to go to your clinical environment. If you're experiencing new signs or symptoms, lumps or bumps, or bleeding when it's unexpected, GP practices want to hear from you. The NHS remains open for non-COVID concerns. I want to say a particular word about lung cancer. Over the pandemic, we've seen fewer individuals presenting with possible lung cancer symptoms. We do not believe lung cancer has disappeared. We need to reverse this trend of decreased referrals. The trigger is still the same, and this is where some of the confusion might arise. If you're 40 or over and you have a persistent cough for 3 weeks or more, your GP practice wants to hear from you. Not to be confused with the newer persistent cough where you should go for your COVID test. The COVID test may be positive or negative. If your cough continues with a negative COVID test for 3 weeks, then please contact your general practice. Lastly, on the subject of cancer, we would encourage anyone who is contacted by their health board to get a vaccine to attend and receive that vaccine. You do not have to worry about getting it even during your cancer care. It will be fully discussed with you and you'll be consented. The UK Chemotherapy Board, who give us advice on matters such as this, made up of leading UK clinical groups and societies, has indicated that the benefits of the vaccine largely outweigh the potential risks of your chemotherapy. My second subject today, briefly, is the well-being of social care workers. We could not be more grateful for the hard work, commitment and professionalism of those working in our social care sector, as well as our NHS workers during this unprecedented year. It's now more important than ever that you find time to rest and look after yourselves by doing the things you enjoy, by connecting with friends, family, usually electronically, and keeping moving and going outdoors for exercise. We're doing our best to support social care staff to ensure they have the resources they require to look after themselves and that they can get any help that they feel necessary. We'd encourage you, if you're in one of these categories, to make use of available support that's available through our National Wellbeing Hub. The website is www.promise, P-R-O-M-I-S, no E, P-R-O-M-I-S.scot. And the 24-hour wellbeing helpline, 0800 111 4191. We'll tweet that later today if you missed it. Since the launch, 61,000 people have used this hub. It provides evidence-based resources to help you manage your resilience, your stress, anxiety, and improve your sleep. It also has information on a range of other services that can provide different types of support to help you and your family cope with challenging situations. It's being constantly updated with new resources. The Wellbeing Helpline operates 24/7, staffed by trained psychological wellbeing practitioners, and offers a confidential listening service for all social care and health staff in Scotland. So please utilise it. Please access help and support when you need it. The pandemic has highlighted the importance of compassion, kindness and self-care, and we've seen this demonstrated in abundance in our communities and across our social and health workforce. Thank you.
Thanks very much, Jason. We'll now turn to the journalists who've joined us today, and first is Kane Nicholson from STV.
Thank you. Good afternoon. You mentioned the new travel restrictions, but given that we're hearing this morning one scientist is warning that at least one case of this Brazilian variant is already in the UK, how concerned are you about this development? And with outbreaks in Barra and Shetland, are you considering moving some of the Scottish islands from level 3 up to level 4 and full lockdown?
I'll ask Jason to deal with your first question on the strain that's been identified and known as the Brazilian strain. On the question of new cases identified in some of our island communities, of course it is a matter of concern where we see case numbers rise, and we have over 2,000 again reported this morning. That tells us that this virus is very infectious, it is spreading, and we need to do everything we possibly can to control that spread and stop it from its tracks whilst we scale up our vaccination programme. As we've said, we look at this constantly, we look at the data. It's always sensible to look at data over a 7-day period. That gives you a better sense than how it may vary from one day to the next. And as we approach this weekend, looking at the data this weekend, as we always do every weekend, we will be looking to see how well we are doing, what more we might need to do, and all of that information and advice from clinical advisors like Jason, our CMO, and others will be taken to the Cabinet on Tuesday, and on Tuesday, Cabinet will make its decisions whether there is more to do or whether we stay as we are. That is for Cabinet to decide on Tuesday based on the most up-to-date information and advice, and having made those decisions will inform Parliament. So that's the right process that we go through. We need to be very vigilant, look very carefully, but make sure that we've got the most up-to-date evidence and advice that we have for any decisions that we might want to take. Jason.
Thanks, Cabinet Secretary. The key thing about the islands, before I do the Brazilian strain question, is partly whether we can relate all those positive cases to other positive cases. So Orkney today has a single case, Shetland has 4 cases, and the Western Isles has no new cases. The Directors of Public Health on the islands just now believe that those outbreaks are under control. They're not seeing sustained community transmission like we are seeing across the mainland. That could change. Of course it could change. We've seen how fragile the position is across the rest of the country, and we keep that under constant review, as the Cabinet Secretary suggests. The Brazilian strain of the virus is a concern, as is the UK mutation, as is the mutation from South Africa. We expect mutations to arise. We have to respond as and when they do. Our genomic sequencing in this country is the best in the world. That's why we can find, for example, if somebody has this Brazilian strain here, and it's why we've put in fairly draconian restrictions both in travel and in the way we look after people if they have particular strains of the virus. We will have areas for COVID cases, but if you have a particular version of the virus, we can further isolate you from others within hospitals and institutions to try and protect us further. However, we're expecting not to be able to hold back every mutation of this virus. You can see that across the whole of the UK in the last 3 or 4 weeks. So the fundamental message, whichever strain it is, remains the same. The way to protect yourself is to stay in the house.
Thanks very much. Matthew Taylor from ITV Border.
Yes, good afternoon. My question is that on Saturday, Scotland will diverge from England to a certain extent in the COVID restrictions. So my question is, do you fear that some people will be tempted to cross the border into Carlisle and places like Longtown, for example, to get takeaways? And is that an acceptable reason to go out and into Scotland? And those takeaways, for example, that maybe can't open because they don't have the ability to, are you putting forward any kind of financial help for them?
So on both your questions, on the second one first, we've put a lot of support in to help businesses who are being affected by the pandemic, including those who can't operate because of the necessary restrictions we've put in place. And I know that my colleague, the Finance Secretary, Kate Forbes, and our Economy Secretary, Fiona Hislop, constantly are looking and discussing with businesses in the business sector about whether there's anything more that we can do. On the first question about people who may travel across the border in order to get a cup of tea or takeaway of some description, my straightforward request to those individuals is, please don't. There is no reason to travel in or out of Scotland at this point, by whatever route, unless you have an essential purpose. And much as I am a great lover personally of coffee, that is not an essential purpose. So please don't do that, because you are breaking the rules. And if you think about it, if you think about what's at stake here in terms of your own health, the health of your family, the capacity of NHS borders to cope with those who need it, then I think you will agree with me that it really is not worth doing this at all. Stay at home, leave only for essential purposes. Where you are going for local food, for essential purposes, including food, try to do that locally if you at all can. Those businesses will welcome your support. And now Andrew Kerr from BBC.
Thank you, Health Secretary. The Education Secretary said today it would be a tall order for schools to return on the 1st. What might the Cabinet decide next week? And to Professor Jason Leitch, how significant is the closure of schools in stopping the spread? And just secondly, this is the first week of ramping up vaccinations. We're currently doing between 12 and 16,000 a day. Can you explain why you're confident we'll soon be able to hit the target of around 400,000 per week?
Thanks very much, Andrew. So I announced earlier today, just a few minutes ago, over 2,000 new cases. That has been a pretty constant announcement over a number of days now from this podium. We all understand the importance of this new variant, known as I think it's been described, it was described to me this morning by one of the vaccine companies as the Kent variant. But we know the one we're talking about. We know it's more infectious, and we can see its impact right across Scotland. In those circumstances, I can understand why the Deputy First Minister said he felt it was a tall order. I would share that view. However, the Cabinet goes through the process that I've described earlier, a few moments ago, and I've described many times. I'm not going to say what I think the Cabinet will decide on Tuesday, because I don't know what we will decide on Tuesday. What I do know is how diligently we will look at all the data, how we will question and challenge that. We will get quality advice from our clinical advisors and others, and we will then reach the decisions that we think are the right decisions for Scotland in order to protect as many people as we can from catching this virus whilst we scale up that vaccination programme. And that takes me to your other point, which is about our vaccination programme. It is working really well. We announced on Wednesday that we had completed 80%, just over 80% of our care homes. Since then, others have been completed in Fife and in Glasgow, Greater Glasgow and Clyde, actually, which is a much wider area. So we are well on track to completing the first of those milestones, which is to offer first vaccination dose to all our elderly residents and care home staff and to our frontline NHS and social care workers. We have planned and modelled the expectation about how many people we need to vaccinate and how quickly we want to get through them. To that end of February, 400,000 vaccinations a week. And I am confident that as I see the scale up and I know what is happening in terms of the recruitment of vaccinators and support staff, the work that the armed forces are doing to support us, our work with local authority partnerships and all the others who are coming on board, from community pharmacies to dentists to optometrists to volunteers to support the whole effort, then I am confident we will get to that number by the end of February. I don't know, Jason, if there's anything you wanted to add.
So Andrew asked specifically about schools. Andrew, it's one of the hardest pieces of advice we've had to give as advisors about how to manage schools. I'm married to a teacher. She would want me to say that schools are not closed. Schools are working. They're seeing a lot of children face-to-face, and they're teaching a lot of children at home. They've adapted the education system, I think, very well in the last week to do that. Our position just now, though, is that although schools are not a large driver of transmission, with modelling showing that 6,500 people a day catch this virus in Scotland, many of whom are asymptomatic, remember, and don't go for testing because they have no symptoms. Many are being self-isolated and kept at home. We think the numbers just now are too high to have all of the adults and all of the children in those school buildings. As soon as that prevalence falls to a level where we think it's safe, we will give that advice to the government, because we know how important it is for the well-being of children beyond COVID well-being to be in schools, to be in these functioning well-being hubs that we call schools.
Thanks very much. Callum Clark from Bauer.
Good afternoon, Health Secretary. Yesterday, NHS Tayside's Medical Director confirmed there are now more COVID patients in hospitals in the region than ever before. Current capacity is at 95%, and there are just 9 available beds at the moment for COVID beds. That is now, the Health Board has said that there are an additional 68 beds it can deploy, but this would of course affect other services. My question is just with cases rising in hospitals across the country, is there any guidance on at what point health boards should deploy extra capacity?
There is. Of course, in Tayside, I need to say, in Tayside as in elsewhere, there's 2 points I really need to make before I say anything else. And first of all, the first point is the sincerest thanks to our NHS staff right across the country. They are working so hard under incredible pressure, and they are managing to help our NHS cope. That shouldn't be taken as something that is easy and straightforward. The pressure that they're facing, the hours that they're putting in, the work that they are undertaking is significant. And I don't think we will ever be able to express our gratitude to them enough or to repay the debt that we owe them. Nonetheless, they are trying very, very hard to do 2 things. To respond and treat all of those people coming to them who've contracted the virus and are ill, seriously ill, very seriously ill in some cases, whilst also absolutely maintaining emergency, urgent and trauma work. And where they can, what we describe as elective, in other words, planned work that is neither emergency, urgent or trauma. And they have discretion within an overall national framework to make decisions, and it can be day-by-day decisions about which areas they can continue to maintain and which areas they might need to pause in order to deal with additional COVID cases that they are facing. And of course, when you report positive cases of 2,000, over 2,000 as I've just done today, you can see that will, in time, find its way through into our hospitals and our ICU units. So it is really important that we give our clinical staff and our chief executives of each of those board areas the discretion that recognises their professional judgment to make decisions on that day-by-day basis, but do it within a national framework. So that is what they're all doing. It is a constant exercise to try very hard to maintain as much non-COVID healthcare as we can, and there is no discretion around emergency, urgent and trauma. That must be delivered, whilst at the same time making sure that we can respond and treat all of those patients who come to us because they have contracted the virus. Tom Eden from PA.
Thank you. Good afternoon to you both. On the vaccine rollout, have you, or has the health service experienced much resistance from people who have been offered the vaccine so far in terms of sort of vaccine skeptics or conspiracy theorists, and what's being said to them if people come forward and say, no, I'm not having it? And related to that, the EU, I believe, is meeting next week and leaders are going to discuss a COVID vaccine passport. Is that something you're considering here in Scotland? And how would you go about that?
Okay, I'll ask Jason to deal with some of these points as well. From my point of view, we try and have tried, and we'll keep on doing it, to put out as much information about the vaccines as we possibly can. Most importantly, describing for people the safety procedures that have gone through before they've been even authorised for use, to assure people that absolutely no corners have been cut here and that all the safety steps and the clearances have been met before the vaccines come for us to then distribute them to clinical teams in order to vaccinate people. That was a really important exercise that we did very early on, I think, and we will continue to do that so that people's understandable questions about all of this could be answered. Some people are not able to take the vaccine. Some people have some concerns about it. What we try and do in those circumstances, and I know Jason will say a bit more about that, this is not something we're seeing significantly at all in numbers in any of the programmes that we're running out so far, and I don't expect it to be the case as we move into other groups. In fact, what we are seeing is a lot of people wanting to know, and again, quite understandably, when will it be my turn? And how will I know? And where can I go to be vaccinated? But we'll continue to put that information out to address people's concerns and listen carefully to what they're saying to us. Locally, in our health boards and various clinics, there is a patient leaflet that people get when they're called for vaccination. And I know that the vaccinating teams take time to make sure that anyone who's being vaccinated, that the consent they give is truly informed consent and that they understand what the vaccine is, what they should expect it to do, how they should expect maybe a slight headache. Once you've had it, we all know, those of us who get the flu vaccine, that there can be, your arm can be a bit sore, or you might feel a bit headachy in the short period thereafter. All of that work is underway. And the final thing I'll say before I pass to Jason is that Scotland has a really, really good track record in mass vaccination programmes and a population that understands the real value after clean water of vaccination to our public health. So whilst we will always try and make sure that people have maximum information about the vaccines, about what we're doing, about how we're rolling that out, and take any questions that they've got really seriously, I am confident, certainly from what we've seen so far in this programme and what we know from other programmes, that the overwhelming majority of adults in Scotland, their biggest question is, how soon are you going to get to me? And my answer to that, as quickly as we possibly can, and supplies allow us. Jason.
Yeah, so a couple of things in there. The true anti-vaccine community is very, very small. And I tell you don't find it within NHS workers, because NHS workers see the direct result of the millions of lives that have been saved by vaccines across the world and have eradicated some diseases. So you don't meet it in that group. And you don't meet it in the over 80s either. There are very few conspiracy theorists in the over 80s group that we're calling in for vaccination. You do, however, meet some vaccine hesitancy, and that's completely legitimate. That question about how have you done this so quickly? Is it safe for me to get this one or this one? What about the gap between the doses? All of that is absolutely legitimate, and the vaccinators will go through that step by step with everybody who comes. We try and put out as much communication as we can, as the Cabinet Secretary said. Every household in Scotland got a letter to try and explain and describe how we've gone through those processes to get us to this safe point. Vaccine passports is an interesting subject. It's a little bit theoretical for now because there's a lot of things we don't know. We don't know what these vaccines do for transmission. We don't know what the world is going to do with vaccines, because vaccine passports are for two things potentially. They are allowing you to do things in your own country, so perhaps go to work, go to public transport, go to a nightclub, and they may in the future be part of what we do around travel, like we're doing with testing. All of that is completely theoretical for now until the science catches up. Europe is thinking about it, so is the UK, so is the rest of the world. But we don't have enough science yet to know if it's a good thing, a bad thing, or we might have to wait.
David Ball from the Herald.
Thank you, Cabinet Secretary. The Scottish Tories have this morning accused you of potentially breaking the ministerial code over your comments on the vaccine rollout and relating to strategic locations. Can I get your response to that allegation? And secondly, obviously, international travel is largely a matter for the UK. During the first wave of the pandemic, the Scottish Government raised concerns with the UK, sort of there was a lack of urgency on travel restrictions being tightened. Can I ask if the Scottish Government has raised any issues with Westminster over sort of a reactive rather than proactive strategy? Given there are reports today that the Brazilian strain may have been detected in the UK, do you wish that the strategy that we've seen in New Zealand, a more stricter strategy, should have been used?
So in answer to your first question, I only just heard that as I was coming into the briefing today, so I don't have detail of exactly what they believe their case is, but the bottom line on all of this is that decisions about whether any minister has broken the ministerial code are for the First Minister, and I am absolutely confident that she will take any such assertion very seriously and look at it in some detail and make up her mind on that. On your point about travel restrictions, and again, Jason may want to say a little bit more about this, I think that what we are always concerned to do is to find the balance, the right balance, between the steps that we think we need to take based on the evidence, based on the science, based on the advice that we get, in order to protect the population in Scotland as far as we can from this virus and break the transmission, prevent it from coming into the country, balance that against the impact of those restrictions on individuals, on their everyday life, their relationships, the quality of their life. And that is never an easy balance to strike. We've always tried to do it on the basis, as far as we can, of a four-nation approach. We recognise the value of that, but retaining, as our colleagues have done in England, in Wales and in Northern Ireland, the right to make the decisions that we think are appropriate for the circumstances that we believe Scotland to be in. And we'll continue to do that and continue to try and work as collaboratively as we possibly can whilst making the decisions that we believe are right for Scotland, because that is our responsibility. Jason.
To be clear just now, David, the problem with travel is the UK is exporting virus, not importing virus. Remember, the public health principle here is don't take virus from high prevalence areas to low. Other countries are banning our travel, not the other way around. But when and if we get this prevalence down, we will have to take very serious decisions around international and national travel. That might be between the islands and Scotland. It might be between Wales and Scotland. It might be internationally. So we have to have an importation policy. And the WHO have said since the beginning of this pandemic, one of the things you require to manage this pandemic is something to stop importation of virus. And if we needed to learn that lesson again, we just need to look at our own history of June, July, August and September, where we re-imported the virus and we got where we are today. So that will have to be considered. The clinical advisors meet on a 4-country level. We are completely aligned in our advice around high prevalence, low prevalence travel. That then goes up to politicians in each of the 4 countries, some of which is only, the powers are only with the UK government. That's not a political point, it's just true. And some powers are for each of the 4 countries on their own. That will be a policy decision made by politicians.
And Dan Viviers from The Sun.
Thank you. Good afternoon to you both. Just to follow up on David's question, the claim is that you may have breached the ministerial codes on the grounds of the confidentiality and security of government business, both with regards to the location you mentioned in Parliament and also the expected vaccine supply figures in the since deleted vaccine deployment plan. Have you spoken to the government directly about their concerns on that? And when can we expect the revised version of the vaccine deployment plan, which, notwithstanding the problematic parts, had lots of useful information in it?
Thanks very much, Dan. I'm not sure about your point about when am I going to speak to the government. I am part of the government, so. But as I said, and thanks for reading out to me what the Scottish Conservatives are saying. It's of interest. As I said to your colleague David just before you, the ministerial code and decisions on whether any minister has breached the ministerial code are decisions for the First Minister. She takes that very seriously, and I'm sure that she will give due consideration to what has been raised with her. On the plan itself, I have to say 2 things. Our intention as a government, I think from the very outset, and people who have watched this briefing, I hope will agree with this, is to be as open and transparent as we possibly can with the information about what we're doing, why we're doing it, what the reasons are for that. And that is because from day one, the First Minister said that she wanted to have an adult relationship with the people of Scotland. I think that was exactly the right approach to take. It remains the right approach. And whilst I regret that we published information that the UK government considers to be sensitive, and I've had those conversations with them and respect their view, we've withdrawn that information and the plan revised with that part removed. Everything else there is back up on our website. And what's important is that it is back up on our website so that anyone, any member of the Scottish public, can see for themselves how we plan to deliver this vaccine and have, at least for now, the initial questions answered about how will I know when it's my turn and what will happen, who will tell me, and where can I go to be vaccinated. The plan itself will be, as I said in Parliament, continuously updated as we move through January into February, meeting all those milestones that we've set out. I don't think I've missed any of your questions there, Dan. Thanks very much. And it's Tom Martin from the Daily Express.
Hi, thank you, Health Secretary. Could I just return to this issue around these confidential details? On December the 4th, the Deputy First Minister told me at this briefing that the government would follow the advice of security services to the letter. Can you just tell me, has this been ignored?
No, it hasn't been ignored. We do follow the advice of the security services. And I think, as the First Minister said, but certainly as I would say now directly to you, a mistake was made in publishing information that was considered to be sensitive. And that mistake was very quickly rectified. The document was taken down very quickly. The information has been removed. And the full plan with all the other very important areas in it has now been published on the Scottish Government website. There was no malicious intent in this. It was an error, a mistake. I, of course, am accountable for that. But it was done with the intention of being as transparent and open with the public about the information we hold in order to explain to them how we are going to roll out what is an absolutely critical vaccination programme. So it's straightforward. I'm not minimising the seriousness of it in any respect at all. But those are the facts. We've apologised for that. I've apologised directly to the Secretary of State for Health in the UK. I spoke to him yesterday, and we move on in order to focus on the really important work, which is rolling out that vaccination programme and vaccinating as many people as we possibly can, as quickly as we can. And it's Scott McNabb from The Scotsman.
Thank you, Cabinet Secretary. Given we now have an election just a few months away and parties starting to make preparations for that, would it be safe in the current environment to hold such a general election in Scotland? If it was for tomorrow, for example, in case numbers at the rate where we see them just now, would it be safe? Do we need to rethink the election? Thank you.
Thanks very much, Scott. The fact of the matter is it's not tomorrow. And my point in saying that is that the way in which the virus will progress rests very much in our own hands as individuals and in our decisions as a government. And our overall objective is not to be in the place that we're in today by the time it comes an election on the 6th of May, I believe it is. The objective is to have by then significantly vaccinated a large percentage of the Scottish population, more than 1.4 million by that time, more than 1.4 million by that time, have gone through the priority groups 1 to 5 and moved on to those who are 50 and over, completing that by the spring. Now, that plus all the other work that we do and the very strong trust and compliance that the Scottish public give us to abide by the restrictions and the rules and the guidelines that we put in place, all of that is designed to suppress the virus and then minimise its impact on those who are most at risk of serious illness and death. So we can't at this point say that it would not be possible to have an election on the 5th of May, remembering that people's democratic right to exercise their view on who should be their government is really, really important in any civilised society. So it's not an added luxury. It's not something that you can easily cast aside. So all our work at the moment is focused on suppressing this virus, minimising its damage, vaccinating the adult population as quickly as we possibly can, whilst we work on the basis that there will be an election in Scotland on the 6th of May, and we continue to review what we need to do at each stage of the process. And that's where we are right this minute on the 15th of January. Rachel Watson from the Daily Mail.
Thank you, Health Secretary. I just wanted to go back to schools and John Swinney's comments this morning about being a tall order to go back on February 1st. Do you expect schools to be fully back and pupils in the classroom by the Easter break? And to Professor Leitch, earlier this week, unions had raised the possibility and suggested that senior students should be the first to go back if there is a phased return. Would that fit in with public health advice and how we know the virus spreads, or would it be more likely that younger pupils would go back first?
Thanks very much, Rachel. I'm not trying to avoid the question at all, but I think as I've explained in answer to some of the other questions from your colleagues, we look at the data all the time, and as we take these measures, people watching this know this by now, know it very well, that as you take measures, you need to give a lag time, if you like, before you see whether or not the intended effect that you wanted to have is coming through. So the serious and quite severe restrictions that we've imposed and asked the people in Scotland to abide by will take time for it to show whether or not they are having the impact that we need, i.e. reducing transmission, suppressing the virus as low as we possibly can, bearing in mind that we're dealing with a particular strain of the virus now, which is more infectious. Alongside that, the vaccination programme, the expansion of the testing programme that I described. And you will see, we've seen it before, if you cast your mind back over 2020, you can see how case numbers rose, then they plateaued, then they started to decline. That's what you need to see happening, and then the decline to keep on declining before you can take a reasoned view based on the evidence and the advice and the knowledge that we've gained about whether or not we can remove any of the current restrictions, ease them in any way, and if so, which ones. Bearing in mind that the absolute priority that we put on the importance of learning and education, and therefore of schools, for our children and young people. That is one of the areas that we are focused on trying to ensure, by all those other measures, as best we can, that we can reopen our schools for face-to-face learning as people have known it over the years. How quickly we get there largely depends on the success of the measures we've taken so far, our vaccination programme, but at the end of the day, it's in our individual hands as well. It's about all of us complying with those regulations and rules as tightly as we possibly can and following that public health advice. On your other point, I'll ask Jason to respond.
So I want schools back in their entirety as fast as possible, as we've already said, everybody does, particularly those who I think have children of their own. The three variables that we'll have to take into account when we give advice about schools going back are the geography of Scotland, the age of the kids, and the number of kids and adults in the schools. And I think all of them are completely legitimate questions for Mr. Swinney to ask for advice on. So if, for example, we got prevalence down very well in some bits compared to others, we might go back to some kind of system where the islands had a different response from the mainland, etc., like we had previously, and that might include schools or early learning centres. Then there is the age. We know that in very small children, transmission is unlikely and low, but still possible amongst the adults in particular. There would be that. And then there would be volume. So if you're bringing back secondary schools but not wanting to fill them up too much, you might bring back examinable children rather than everybody else. Completely legitimate questions. I don't know what the answers are to them yet, but our education recovery group, which looks at all of those things scientifically, both from a public health perspective and an educational perspective, will give us that advice.
Thanks very much. Simon Johnson from The Telegraph.
Thank you. You pointed out, obviously, that the plan containing the sensitive supply figures has been taken down. but has the damage already been done? Because it's very, very easy to get the original version online. The figures are easy to find on social media. Also, you said you regret this information was published. Do you also regret publishing or announcing in the Chamber the sensitive location of the vaccine storage site? I've also got a question for Professor Leitch. Public Health Scotland this week published vaccine rollout figures broken down by area, and there's quite a large variation from 6.76% of the Western Isles vaccinated to 2.63% in the Highlands and around 3% in Lothian and Glasgow. What's the reason for that disparity, and does it make sense to have a sort of the highest vaccination rate in an area with no cases? Is there a case for sort of weighting the vaccine towards the areas with the highest COVID rates? Thank you.
Thanks very much, Simon. Look, I take issues of sensitive and confidential information really seriously. A mistake was made in the plan that was published, where some of that information was put into that plan. As soon as we were aware of that, we took the plan down. I have apologised for that to my colleagues in the other 4 nations and to any others who've been impacted on that. But the important point I think I also want to make, not that that is unimportant, is that none of this was done in order to cause upset. It was done in order to be as transparent as possible, answering the perfectly reasonable questions that people across Scotland have about the vaccination programme, and that I think, as the Health Secretary, I have a responsibility to answer. And that is, how are the vaccination doses coming into Scotland, with what volume, and how does that allow you to tell us that you will have, for example, vaccinated all elderly people in care homes, all frontline health and social care workers by the end of January? Prove it. That was the question I was trying to answer. And I will continue to try and answer that question whilst continuing to respect confidential and sensitive information. So I regret that what was done with the right intentions, I firmly believe, has caused some upset, and I have apologised for that. And in those conversations, I am confident that those I have spoken to are now content and we can move on. It has not damaged the relationships between myself and the Secretary of State at UK government level or my colleagues in Wales and Northern Ireland, and I know that because I spoke to all 4 of them last night. We will continue to do our very best to work together, to work collaboratively, as we have done, to make sure that we are all doing everything we possibly can to both help our population suppress the virus and stay safe, and vaccinate as many people as we possibly can. I think your other question was probably for Jason.
2 questions in there, Simon. One is on the percentages variation between the boards. I would expect to see that at this early stage. Remember, we're targeting 3 groups: over 80s, care home residents and health and social care workers. Frankly, the proportion that makes up of your society varies from the Western Isles to Edinburgh City. And I'm very encouraged that the Western Isles have been able to do 6% of their population. And I would expect that number to continue to rise. I think you'll see constant variation over the next few weeks as different groups get done at different stages. The logistics of getting it done in certain areas are more challenging. So small nursing homes, slightly more challenging than big ones. The Western Isles has a lot of its people concentrated in one town in Stornoway. That's where the hospital is. It's where the big care homes are. So it's slightly easier for them, perhaps, than some other areas. Your second question is, should we go to high prevalence areas with vaccine? Well, frankly, there aren't many low prevalence areas in Scotland just now, which should be a warning to all of us. The Joint Committee considered that, as they always do with vaccines, and they said no. They said that the way to save lives in this pandemic at this stage with this vaccine is to start with the elderly and work your way down.
Thanks very much. And last journalist today is Adele Merson from Press and Journal. Adele.
Thank you, Cabinet Secretary. A recent study found that more than a quarter of 18 to 34-year-old women say they would say no to a COVID-19 jab, stating unfounded concerns on the vaccine's effect on their fertility. Is Government planning a targeted information campaign to sort of tackle misinformation within this area specifically? And what advice would you offer women who may still have concerns, however unfounded?
I'm going to ask, thanks very much, Adele. I'm going to ask Jason to deal with the bulk of that, because it clearly is around the clinical issues and the impact of the vaccine on different groups of people. The one thing I would say, I've not seen the survey that you are referring to, but all of this information we take very seriously indeed. We want the majority, the overwhelming majority of adults in Scotland to take this vaccine and to come back for the second dose. The second dose is really important because we are convinced of the safety and the efficacy and the impact of it and its value in helping protect the population. That is really important to us. So we need to pay attention where people have hesitancies and legitimate questions that they want to ask us, and respond to those as frankly and as quickly as we possibly can. And on that note, I'll ask Jason to deal with it.
It's a really important point. The first thing to say is it's factually wrong. That doesn't always help us, though. So it's biologically implausible that vaccinations could cause any effect on infertility whatsoever. So it is not true. That doesn't help us, though, always with people who get their news in different ways from watching this briefing, perhaps, or reading your newspaper. So we have to use trusted sources as much as we can. And that would be my advice to those of you with kids, relatives, friends in this age group who are worried about this, and they get their news from non-trustworthy sources, frankly. So they should go to the Royal College of Midwives. They should go to the Royal College of Paediatrics and Child Health. They should look at Young Scot and what they are saying about it. They don't have to just listen to the Scottish Government or the Scottish Government advisors. There are other independent ways to get this same knowledge. I don't want to give this kind of conspiracy theory any more credence than it frankly deserves, but I do want to tackle that misinformation in a really intelligent and deep way, because those who are young still need the vaccine. They need it for themselves, but they also need it to protect their elderly relatives. Vaccination just now is about protecting the individuals. Vaccination in the future will be about protecting the whole population. So this group need vaccinated.
Thanks very much, Jason, and thanks very much to all journalists who've joined us today, to Jason for joining me, and to all of you for watching, and to Anna, our BSL interpreter today. Let me finish with a couple of points. As we go into this weekend, I know how tough this is. I know how scunnered we all are with it. But it is really important that we stay at home, we stick to the rules and the guidelines as tightly as we possibly can. We only leave home for essential purposes. And in leaving home, we do that for as short a time as possible. If we're meeting someone outdoors, it's only one other person from another household. I know it's hard if your kids are at home and you're trying to work from home and also help with their education. None of this is easy, but it is really important. On a day when I've announced over 2,000 new cases, that we take this so seriously. We will get through this. We will if we stick to the rules, if we follow the guidelines. We'll work as hard as we can to support the NHS with expanded testing and rolling out the vaccination programme. We'll all work hard together and we will get through it. But for now, please stay home, protect the NHS and save lives. Thank you.